Kicking us off today is Rebecca Sinke. She's Senior Program Officer at the Michigan Health Endowment Fund, which is a foundation aimed at improving health and wellness of Michigan residents with a particular emphasis on children and seniors. In this role, Ms. Sinke is responsible for designing and implementing the fund's strategic grant programs, overseeing grant activities, and developing partnerships aligned with the fund's mission. Previously, she was the Chief Operating Officer for the Michigan Primary Care Association and has also worked for the Mid-Michigan District Health Department. Please welcome Rebecca Sinke.
Good morning, everyone. Thanks for having me here today and for the warm welcome. I told my kids this morning that I was coming to talk at a technology conference, and they did not help my self-confidence when they laughed out loud because I couldn't hook up the printer at home last night. So thank you for having me. While technology is not my area of expertise, I'm certainly amped to be here today with all of you, with so many grantees and partners and others in the room doing really impactful work in communities. The leadership that you all show in this space and in healthcare is really remarkable, and thanks for the opportunity to be here. I've been asked to give you a bit of an update on who the Michigan Health Endowment Fund is, on our grant making. I'm actually just looking for my slides. Will someone else advance them, or am I to do that? Oh, perfect. Great. Thank you. To give you an update on who the Michigan Health Endowment Fund is, the grant making that we do, and a little bit about the work that we've done in the health information technology space and the health space. If you'd like to advance to the next slide, the Health Fund is a philanthropic foundation. It was established in 2013, and we support partner organizations throughout the state that are working to improve the health and wellness of Michigan residents, with a particular emphasis on children and seniors. As you can see here in our mission, we do have that special focus on children and seniors, and also it built into our mission is that we work exclusively in Michigan. So all of the grant funding that we support is done here in this state. The Health Fund was created by the Michigan legislature in 2013 when it authorized certain changes to the way Blue Cross and Blue Shield operates in Michigan, and the law requires an investment of up to $1.56 million over an 18-year period to establish a health endowment fund in Michigan to benefit the health of Michigan residents. And the Health Fund does receive its funding through Blue Cross Blue Shield of Michigan, although our board functions independently and is appointed by government officials. In terms of our grant making, we've really grown at the Health Fund since the start. Some of you are probably well aware of the Health Fund, and others we might be a new entity to you. We have been grant making since 2014, and as I said, that trajectory of grant making has continued to increase. So this year we'll grant over $30 million in awards in our 5 programs on an annual basis again. So beyond grant making, though, we really do want to be partners in communities and partners not only with our grantees but other potential applicants. So we're regularly and more so in the coming last year and moving forward going to be hosting convenings on topics of interest to our grantees and to partners. For example, in this past year we did some training on Medicare managed care contracting for behavioral health providers. We're also looking at how we can encourage thoughtful policies and best practices that support systems improvement throughout the state. So that includes working with our grantees, both in having conversations with policymakers and also in promulgating white papers and other reports of interest. For example, later this month or early next month, we'll be releasing a study on behavioral health access in Michigan, which I'm really excited to share with all of you. And again, we have an emphasis on evaluation and learning. We think it's really important that we learn from the challenges and the successes of our grantees. And we think that that learning opportunity is just as important as the outputs from those grants. Sometimes projects don't go well, and we continue to learn from that as we modify our grant making and the work we're doing out in the community. If you wouldn't mind advancing to the next slide. I wanted to share that when the Health Fund was formed, not only did the focus on children and seniors become a priority, but the legislature defined 8 focus areas for the Health Fund, and one of those focus areas is technology enhancements. In that space, we're funding a number of areas, including remote monitoring tools, telehealth, enhancements to the health information exchange, and a number of other technology enhancements. On the next slide, you'll see a little bit more detail about our 5 grant programs. So each one of these grant programs are offered on an annual basis, and 4 of them are open to all Michigan nonprofits or governmental entities. The last one, Special Projects and Emerging Ideas, is the only opportunity that is by invitation only. In that round, we're having conversations with key partners throughout the year, including state government and statewide associations, really looking for projects that are likely to have a statewide impact or transformative change. So we invite those folks. Actually, this week, we're inviting invitations for Special Projects and Emerging Ideas. 4 out of the 5 grant programs we fund make awards of up to $500,000, with the Community Health Impact being the smaller grant round, and those projects are up to $100,000. And each of those grant rounds, we invite people to submit concept papers. For most of them, you can submit those concept papers throughout the year. So we look forward to hearing your ideas and having conversations long before the grant cycle opens. Moving to the next slide, we're excited to reveal our 2019 technology report. Thank you. That report was just released a couple of weeks ago. And it's really an opportunity for us to highlight the work that we've done in the technology, grants we've made actually, in the technology space since 2015 through the spring of this year, and really to look back at those investments and figure out what's gone well and how we might continue to do grant making in that space moving forward. And really we want to broaden our understanding of the impact those grants have had. So since 2015, the Health Fund has invested just under $13 million in 46 programs supporting technology-based interventions. And we've learned a lot, I should say. From those grants, we've learned about projects that have sustainable change throughout the care continuum. And we've learned about how partners and communities are using technology really to improve access and, of course, in quality. So you'll find the full report at the website noted here. It's the Health Fund website under publications, and you're welcome to access that. We're excited to get it out in the field. See, here's the tech. I'll let someone else, thank you. So, excuse me. We broke the report into 8 different categories so that we could look at our impact in each of those areas. The area that we made the largest number of grants really in that single category was client education and behavior change communication. Thanks, Janet. So one example of that grant is one that I'm going to highlight on the next slide. It's a grant called High Touch, High Tech. All right, someone else did it for me. So I wanted to highlight just 2 quick projects for you. One is the High Touch, High Tech project of Wayne State University. This project really was designed with the recognition that substance abuse and mental health challenges do exist during pregnancy, and there are significant long-term impacts associated with that use. We wanted to encourage providers to do more screening and intervention for women who are pregnant and struggling with either substance abuse or mental health challenges. So the tool transfers the mental health and substance abuse risk screening of expectant mothers into a tablet-administered tool that's handed to women when they present in an OB practice. The tool also includes a number of educational components based on the feedback from the woman during the survey, has embedded motivational interviewing, and the results of that tool are available to the provider should the woman elect to share those results. I think that it's been really remarkable in terms of the number and the compliance with completion of the survey. We're seeing so far and early on some really great outcomes from that work. But it did take buy-in from folks throughout the practice, not only the nursing staff, but the front desk staff and everyone else, to be sure that every woman was handed a tablet and participating. And it also takes buy-in in terms of having community partners come together to identify strategies for a positive screen. So that program started in 2 sites and is now spreading in 2 additional regions throughout the state. We're excited to see that spread. The other project I wanted to mention was the Washtenaw County Community Mental Health Correctional Care Integration Project. And this project really, it was focused on connecting health information exchange both in youth and adult correctional facilities in Washtenaw County. So it really did require, as you can imagine, a broad group of stakeholders that came together to amend existing workflows within those correction facilities and within the broader community. It required partnership with Great Lakes Health Connect to integrate the HIE and correct care solutions, really to revise their existing workflows within the corrections system. And we were really excited about the potential for expansion of that project as well, statewide. I wanted to share just a little bit about some of the lessons we've learned and then open it up to you guys for any questions we have. So the lessons we've learned at the Health Fund, which are illustrated in much more detail in that report, really are in part the nature of the Health Fund grant making. When the Health Fund was created, we were required to make grants of no more than 3 years. For that reason, we make grants of about of 2 years, recognizing that most of our grantees ask for an extension. And so this report really provides insight into the ability of technology-based investments to have a large impact in a short period of time. We've learned that most of the tech-based interventions that we funded to date have really sought to address gaps in access to care in some way. And that integrating tools and approaches requires a lot of changes to existing practices and workflow. No surprise, I'm sure, to those of you in the room. And it really does, I guess a good example of that is the work in high touch, high tech, where everybody in that practice had to be involved in the design. Some of the challenges our grantees are facing tend to stem from two areas, really: overestimation of the technology's potential impact, and also sometimes an inability or hesitance to adapt to obstacles or delays in the model. Most of our grantees who have experienced success have thought of technology as a part of a larger person-centered approach rather than a distinct technology project. Again, probably not a surprise to many of you. And there, as you know, there are significant gaps between the development of new health-related technologies and implementation within the healthcare system. So we think that that's a great space for the Health Fund to continue to play an important role. So from our perspective, there are a couple of areas that we identified in the development of that report that we think that will continue to make investments. Telehealth is one of those. Mobile technology and approaches to health information storage and exchange are certainly areas that we're interested in continuing to invest in. I'd be happy to take any questions that you have about the Health Fund in particular. I can certainly try to answer any questions you have about our technology enhancements, but I wanted to thank you guys again for the chance to be here today. I'm excited to learn from all of you throughout the morning and afternoon. Thank you. Any questions at all? All right. Oh, yep. That is a great question. There are, as I said, there are 5 grant areas that we work in, and one of our 3 proactive areas is healthy aging. And that's focused on older adults throughout the state. And one of the areas of emphasis in healthy aging is caregiving. And we have also had a number of projects specific to healthy aging in the health information technology space, in coordination of care using technology. And I am not the program director for healthy aging, but that's Carrie Cedarberg, and she and her colleague Tim Neosanga would love to talk to you if you have other questions about that space. That RFP, I should mention, is open right now, so if you're interested in looking at that opportunity, feel free to jump on our website and you'll find a full RFP around healthy aging. Jan? Yes, you can find a list of all the grants we funded for every year, every grant cycle on our website. Thank you for that. Great. Thank you, guys.